Hi, I'm Dr. Jeffrey Riopel, and this is a series of short video clips designed to help our patients understand our practice better. I'd like to talk to you a little bit about varicose vein treatment and leg edema treatment. We have a full array of treatment options in our practice for treating varicose veins and leg edema. Let me talk a little bit about varicose veins. Well, varicose veins are dilated blood vessels that have either been stretched out of shape or have been stretched to the point that the valves in the blood vessels no longer work. Normally there's a flow upward in an upward direction of blood from the legs to the heart, first through little tiny vessels, then to larger vessels, then into the superficial veins, which are the ones that are actually not so visible under the skin but aren't the deep veins. Any one of those vessels can become dilated and not function properly, creating a varicose vein or leg swelling. Generally, though, we want to treat the closest vessel to the heart that's bad first, because if you go ahead and treat the smaller vessels, the ones that are further out that are dilated, and don't treat the closer ones, if they're bad, you won't be able to get rid of the tiny ones. So as a result, we find that it's necessary in virtually every patient to do some type of technique to determine if some of the deeper vessels are working or not. Now, once we've determined that, we can then go ahead and treat in the most effective way. We use an ultrasound or Doppler to determine if the not so visible veins are dilated, and we use some special lights which can actually see veins under the skin that we can't see with the naked eye to tell if they're dilated. So once we've found out what the problem is, we then will chart out our treatment course. If the medium-sized veins that are not visible are the ones that are dilated, then we need to treat with some more advanced technology that involves a little more work. And that's where some of the laser technology now comes in. In the old days, these are the same veins we would strip, primarily the greater saphenous vein and the lesser saphenous vein in the leg. Stripping is pretty much a thing of the past now, though, because we now have lasers that we can insert into the vein, which will actually destroy the vein, and the body reabsorbs it in a much nicer technique than having to have the vein stripped. The recovery is fairly minimal, the risk is fairly minimal, and the technique works as effectively or even more effectively in many cases than vein stripping for long-term results. This is a laser fiber, and what's done is we visualize the vessel under the skin with an ultrasound, and then we'll put the laser fiber into the vein, first using a needle, and then watching the laser as it goes up the vein to the point that we want to laser where the vein is bad, and then we simply laser back down, killing the vein. So that's how we take care of the bigger veins that used to be stripped nowadays. What about those great big bulging ones that you see on the surface of the skin? Ones that are maybe this size, that are gigantic bulgers. Well, those can now be taken care of with this simple little device. This is actually a hook, and this procedure is called hook phlebectomy. We simply numb the skin right over the vein, make a little needle hole, insert the hook through the needle, and pull the vein right out. And the vein comes out, and what's left behind actually contracts down so that there's not a lot of bleeding in terms of the procedure. So that's how we take care of the big bulging ones. What about medium-sized veins that we see in the legs? Well, those can be taken care of with either injection of a sclerotherapy solution or with lasering. This is an ND-YAG laser, which we use commonly for treatment of veins. And the laser pulse will actually come out of the head of the laser here. So if we have, for example, a vein that we want to laser, we'll put the laser right there, cool first with a cooling tip, and laser the vein to destroy it. Again, the body reabsorbs the vein, and as time goes, the vein goes away. Finally, for the little tiny capillaries, again, those can be injected with a sclerotherapy solution, or using a different setting on the laser, we can laser the very fine capillaries. Some capillaries are actually too small to get into with a needle, and so those are perfect for using the laser, because beforehand there was no way to get rid of those, and now we have great ways. So as you can see, here at Laser Advantage, we can treat pretty much any vein or any person with any type of vein that comes to us with the broad variety of treatment modalities that we have.